You had mentioned meaningful use. Educate folks who may not be knowledgeable about what meaningful use is and how it's valuable today.
Well, in the HITECH Act, one of the things that the federal government did was to recognize that we need to transition away from paper medical records into online medical records for a variety of reasons, including facilitating adjudication of claims, including reducing the cost of managing healthcare, and including improving the quality. So you take the IOM study to err is human and recognize that a significant chunk of what's recognized as medical error starts with the physician writing an order in a patient record. All of that could be improved if we were to have an electronic patient record with appropriate computerized decision support systems guiding interaction with that record. The problem you have is you can't just say to somebody, okay, you need to go buy this equipment, because as we learned with infusion pumps, for example, there were a lot of people who bought some very smart pumps and made them very dumb, right? So meaningful use was a method by which the federal government could, was a set of standards by which the federal government could determine whether or not you had not only acquired electronic medical records and the surrounding things, but were using them in a meaningful fashion. So this is a multi-phase series of evaluations. Meeting the criteria at any given phase gives you the opportunity to pick up a carrot, in this case money. By the way, there's also a stick. Your failure after certain periods of time to meaningfully use these actually results in a loss of reimbursement from the Centers for Medicare and Medicaid Services. So meaningful use turned out to be important and has had a huge impact in a very short period of time on the deployment of electronic medical records, not only in hospitals, but in physicians' offices and clinics.
What are the unique needs of pharmacists that practice in informatics?
I'll go back to the Wither Informatics article because I think it really kind of drives that. You have to like it. You have to really like it. You have to be willing to understand not only the use of drugs clinically, because without that you can't make appropriate decisions, but you also have to understand the long-term downstream impacts of individual design decisions about something as simple as how you enter something into a formulary, or something as complex as how you put together a bunch of disparate systems to make them work together. You need to start looking at your profession. You need to be willing to look at your profession in a completely different way. You need to be willing to step back and ask yourself, why do I do that? And having asked that question, be willing to answer that question with, it doesn't really make any sense. We've just always done it that way. You have to be willing to ask yourself, what would the practice look like if I did it a different way? And you have to be an exceptional change manager, because most of the profession will struggle to follow you when you ask those questions, because we're very comfortable in the way we do things now. So you need change management capability, you need systems analysis capability, you actually need to know something about how software works and how database works. You don't need to be a programmer. There are other people who do that better. You don't need to be a database architect or a database administrator. There are other people who do that. But you need to know enough about those disciplines to know when they're serving your purpose and to know when they're not, so you can guide the direction and the implementation of the technology over which you have responsibility.
What advice do you have for young pharmacists that are interested in informatics?
Well, the first thing we said in the Wither Informatics chapter, or article, and I still believe this very firmly, the first thing you need to do is you need to be a pharmacist. You need to do the job you're trained to do. You need to develop the experience necessary to actually be able to speak to the profession. That probably means working in more than one hospital. That probably means seriously looking at and getting involved with the acquisition of informatics products. It probably means trying your hand at programming, not so much because you're ever going to be a programmer, but because you need to understand the realities of how programs work. It definitely means having an ongoing love affair with technology and being attracted to working with it and trying to make it work in your environment. One of the big mistakes I see people making from time to time is becoming enamored of a technology, typically a hardware, and not thinking about whether or not that hardware is actually suitable. So I have this smartphone. Certainly there must be something I can do with it. Well, maybe, maybe not. Is the screen big enough to read? Can it hold enough data? Is it properly secured? All of those things turn out to be interesting questions. If you're interested in informatics, you need to know the regulatory environment. You need to know about HIPAA. You need to know about high tech. You need to know about meaningful use. You need to know something about contracting and some other things that help you establish the kinds of business relationships with your vendor community that will be helpful. So spending some time doing those things is good experience. And I could probably go on ad nauseum, actually, but those are the things I would think of as being the most important.
And I think there are some informatics residencies available these days.
I'm aware of about 4 right now. I don't want to advertise any one of them, but it's the thing, that I like about these at the moment is they're PGY2 residencies. Okay, so you can't get into one of these until you've done a general residency. You actually have been at least exposed to the panoply of pharmacy practice, right? It's still not clear to me that someone coming out of one of those residencies has enough miles on the tires to actually make informatics a career. And I would still encourage them to spend some time in a role that is at least partly practice and partly informatics until they get that experience. Because I think at the end of the day, that's really what it takes to get into the role.
What's been the value of professional networking for you, and how do you maximize it now?
We often joke how small a world the pharmacy community actually is. I think first and foremost, you eventually have to get to the point, especially in informatics, where you recognize that you don't know everything. And maybe you can't know everything. And maybe there are some things that you could do, but other people would do better. And so having a ready connection with those individuals, so you can pick up the phone or drop out an email or what have you, and build a network and ask those questions and get those perspectives is really important. Some tools are fairly hands-off. I generally look at the communications that go through ASHP Connect, for example, as kind of hands-off. I'll throw a question over the wall and someone will throw an answer back over the wall. But what I even find there is that eventually, if your answers are thoughtful and your questions are thoughtful, eventually you develop connections with individuals who really want to explore a process in detail, and those become connections. Attending meetings and actually getting physical meetings going with individuals. I find that personally, until I put a name and a face and a voice together, I don't have a connection with that individual. When I have that connection, I can pick up the phone and have a trusting conversation on any of a variety of issues, and it works reasonably well. And it's worth the time and the effort to keep those relationships intact, even when I'm not doing anything at the moment that needs them. I use a an email service that reminds me when people have birthdays, and I make sure that I get they're online e-cards, and nobody's fooled about how much effort I went to do that. But at least once a year, we exchange something. How are you doing? What's going on in your life? I'm looking for. And it's just amazing how often those just suddenly crop up, being useful either to the other person, to yourself.
Let us benefit from your unique perspective. Please talk with us about the value of the currently available social media and what pharmacists should be aware of as they use that, either career-wise or personally.
Social media is a two-edged sword, very definitely. And I think that one of the things we're learning with social media is that different generations communicate with each other in highly different ways. Being somewhat older, I have a tendency to use email. My daughter's Twitter, right? And tweet. And I think that the thing we have to kind of look at here, and I guess the first thing, I always approach these with a bit of caution. In fact, I even approach email with a bit of caution, simply because it represents a venue from which nothing ever disappears, right? So how I use this, whether personally, whether publicly or in private, how I use these venues paints a picture of me that never gets erased.
Even if you attempt to erase or delete, it's
Absolutely.
Still there.
Absolutely, and it's for many people, it's become their picture of Dorian Gray. I mean, it's really, really difficult. Photographs that you thought were completely innocent at some point come back to haunt you in a job application, and employers do scour the social media to evaluate new employees. So we're never really off the job, especially when we're using social media. And we need to be careful of the picture that we paint of ourselves in that regard. There's been a lot of real interest in healthcare, especially if we were to actually move to a completely capitated method of paying for healthcare, about how we might use social media to improve the relationships and the correspondence between care providers and patients. And again, I think we have the same issues there. Patients still need to worry about their privacy and how much privacy they can have in a social media environment. There have to be ways of managing those conversations. There are regulatory and litigatory issues that you worry about in terms of doing that. But I've talked to physicians who've told me, frankly, they wouldn't need to see me quite as often, and they would probably be able to help me manage my care far more effectively if we were emailing each other. One of the things we've seen in the medical device community that's starting to get interesting is just the notion of having devices tweet over a secure channel back to a database that allows us to better manage and monitor their behavior. Fairly far away from that at this point, but it's an interesting use of the concept. But I generally see social media as being more applicable to personal than to professional activity, and so I'm going to be interested to see how it evolves. At the moment, I'm a bit skeptical of it.
This kind of leads into my next question about what changes do you think will happen in informatics and technology over the next 5 to 10 years that are going to affect pharmacy practice?
The things that I really hope will happen at this point, because I'm still seeing us struggling with some of these issues, is that we will get past the growth curve of getting people on online medical records. And we will begin to actually leverage the promise that those databases of patient data provide. And that suggests that there's a need for a group of tools out there that are probably now only in their infancy, that help us digest this massive amount of information and bring to our attention those things that require our attention and input. A good friend of mine, in fact, the fellow who started Health Data Sciences, Ralph Kortman, used to talk about the complementary features of a computer system and a human. Because a computer system can doggedly apply and rigidly apply a set of rules over a massive amount of data and never get tired and never make a perceptual error, right? Barcode scanners never misread a barcode, almost never, right? Human beings have known error rates. In fact, there's a surprisingly robust amount of information coming out of the nuclear power regulatory industry and oil rigs, of all places, that talk about the propensity of an intelligent human being to make a mistake. And at the end of the day, an error rate of roughly 3%, so 3 out of 100 transactions, is considered normal for an intelligent human being. And when you put that individual under pressure, that rate can raise as high as 25%. So when we look at the notion that we as human beings have perceptual failures, we get tired, we develop confirmation bias, we do all sorts of those things. Expecting ourselves to do this kind of work is really, really foolish. And in point of fact, we are probably now at the point in our professional practice where the sheer volume and acuity of work we're doing is so high that it is beyond the capacity of human diligence. So what we really need to be doing is focusing that perceptual energy on the cases that need our attention. Alan Flynn did an op-ed piece on what he called NUPOR, Nearly Universal Pharmacist Order Entry, and he raised the question that by looking at every order, were we somehow missing the opportunity to really spend our energy on the orders that need our process. And so the role of the computer should be to digest all that mostly normal information and find the needles in that informatics haystack that really deserve our attention. And then the role of the human is to do the things humans do that computers can't do, which is the ability to make intuitive leaps based on incomplete information, to develop a set of direction where an intense analysis of all the available data would probably leave you confused, right? Dr. Kortman used to refer to the notion that as a hematologist, he'd walk into a hospital room and he'd look at the patient and he'd go, liver cancer, and then spend the next 3 days proving that he was right or wrong. But there's this gestalt process that we've never been able to computerize and are unlikely to be able to do so. So the best match of the tool to the person is to create a process where the tool finds all the things I should be looking at, presents them to me, and then lets me apply my unique skills to focusing on those. And that, I think, is the next real horizon. The current computerized decision support systems The current computerized decision support systems focus mostly on order entry. But a significant chunk of what needs to be focused on are the downstream impacts of what appears to be a benign order. And so we're talking now about products, and there are a few now on the market that actually are starting to do this, that actually watch patients over time who might be at risk, right, and come back and say, you might want to go follow up on that guy because he's been on Coumadin for 4 days and there's no INR in the chart, right? And those kinds of things. There's starting to be now some what are called inference engines at which you could literally throw a database with no guidance at all. And the inference engine will actually go through and come up and tell you about all of the data relationships that it finds. And some of them are, yeah, okay, fine, that's right. You never have oophorectomies in a male patient, right? But then there are others that turn out to be, oh my God, I never saw that value. I never saw that association. And I think that's the next big thing. Just this notion of something that's constantly watching this on a population basis and is noticing relationships that we should at least investigate. They may not turn out to be real. They may turn out to have an undisclosed cause, but we need to look at them. And right now we don't even know that we need to look at them. And we don't have the mental capacity to find them without computerized assistance.
What advice do you have for non-informatics pharmacists of keeping up or trying to stay abreast of what might be coming?
I think the reality is, first and foremost, that pharmacists need to be aware that informatics should change the way they work. Okay. One of the biggest mistakes I see pharmacists doing generally is taking technology and layering it on top of what is a currently evolved practice. And if it's looked at closely, in many cases, it's broken in various places, or it relies on tribal knowledge or on inference, things that make it very hard to replicate and scale. And so first and foremost, if you're thinking about applying technology, you really want pharmacists to think about, what would my practice look like if I used this technology the way it was designed to be used? And then how do I go about teaching myself to do that without driving myself crazy? I think pharmacists need to recognize that the technology that they use in their personal lives is fundamentally different than the technology that they use in their professional work. Now, from time to time, it may be possible for the same device to do both. But in point of fact, by and large, there are rules around the stuff you use for work that you don't have to live with, right? You can't just completely make it your own because somebody else has to pick it up behind you and keep working. So you have to approach that technology differently, certainly with a certain amount of care that you might not in dealing with your personal technology.
As you think back over your career, how do you judge your own success? Success measures. I know that's a tough question, but
actually, I had given some thought to that because you asked me, and I think at the end of the day, I look back over time, and I think, okay, there were moments when I felt success. The marriage of my children, the birth of my grandchildren, seeing people who were my students when I was early in my career who now occupy positions of authority both in practice and in industry. People who periodically call me up and say, gee, I remember when you said, right? Now the opportunity to mentor new students and see them asking hard questions and pushing the boundaries of the profession. And to the extent that I've had anything to do with that, I find that a measure of success. Knowing that a product I was involved in making actually improved the safety of patients, and I actually have data to support that, that's a pretty big measure of success. But by and large, success is a set of vignettes. You'll notice I didn't talk much about money. I took the job in industry, my first job in industry, with a $20,000 a year cut in pay because I knew I would love it that much. Turned out I loved it too much, but there's something to be said for wanting to get out of bed every morning and do what you do. And I think that in itself is a measure of success.
Dennis, these have been great comments. I really appreciate your time. Thank you very much.
It's been my pleasure. I enjoyed it, Sarah.